Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. From search and rescue to medical alert to narcotics detection, working dogs and their handlers can do amazing things. And while our guest today specializes in keeping these professional athletes in top condition, she has some great advice for all practitioners working with dog owners on preventative strategies for osteoarthritis. Dr. Megan Ramos is the medical director of the Penn Vet Working Dog Center and a lecturer at the University of Pennsylvania. She conducts research in many areas, including preventative health care, physical conditioning, and the overall well-being of working canines. So thank you for joining us, Dr. Ramos. It's great to have you.
Hi, Dr. Cassie. It's a pleasure to be here.
Absolutely. And I love this topic and I love working dogs. So I'm really excited to pick your brain about this and see what your experience is when it comes to osteoarthritis.
Yeah, we're very excited to talk about it and hopefully we can get some good information out there.
Yeah, absolutely. Well, one thing we always talk about in the context of osteoarthritis, but really it can't be emphasized enough, and that's preventative strategies for osteoarthritis. So can you walk us through your thoughts, your strategies on osteoarthritis prevention?
Yeah, so it definitely starts in the beginning with what puppy are you dealing with? What is their expectations for their lifestyle? Whether they're going to be a couch potato and be that ultimate snuggler, or are they going to be like some of my patients where they're going out to save lives and protect the community? So what are we expecting those joints to do, and how much kind of wear and tear is going to be put on those joints long term? So it kind of is a whole multimodal approach as we're looking at these dogs and what our expectations are. But I will say osteoarthritis affects everybody. Affects the couch potato to our elite athlete. It's just when does it show up? How does it show up? And what are those kind of predisposing factors that lead us to osteoarthritis?
And so I'm curious to know predisposing factors. I think, again, this is something we talk about a lot, but it always bears repeating. And I always seem to learn something when I ask about what are the predisposing factors to osteoarthritis.
So some of the known predisposing factors are breed, which a little bit goes into the conformation of the dog, so how they're built and how the joint angles come together. Weight, we know that being overweight, having a higher body condition score definitely predisposes them to getting osteoarthritis, and as well as activity, which is kind of paired to weight. But we want to make sure that we are moving those joints and having that dog go through range of motion, because we know the joints, when they're through movement, the synovial fluid kind of coats the joint to keep it healthy and pass the nutrition necessary to keep that joint moving and helpful. So it's not just keeping the dog lean, but keeping that dog moving in an appropriate, age appropriate, and also kind of endurance level appropriate for that canine.
That makes sense. And I think somewhere in the back of my mind, we've talked about the synovial fluid coating the joint during movement, but that's another one of those that is not top of mind when I think about prevention strategies is making sure, age appropriate, endurance appropriate movement for that patient. So like I said, I learn something every time I ask that question.
It's a great question. And I will say we learn more and more, if not every month, every year, with new research coming out on what is appropriate and what intervention strategies we can implement for sure.
Sure. It's so cool. All that's coming out about a lot of different disease processes, osteoarthritis included.
Yeah.
One thing that I've heard you say, and it just rang so true for me, I loved it. And I was like, oh, that makes so much sense, is we can't change how the dog is put together. And we know that we have certain breeds, certain joints that are going to be prone to developing osteoarthritis later on. So I'm curious to know your thoughts on screening for osteoarthritis if we have a patient who we think is at risk.
Yeah, definitely. And it's a great question. So I think what's most important are to identify the joints that are most at risk based on the breeds that we have. So if we're talking about Labrador retrievers, if we're talking about German Shepherds, if we're talking about French Bulldogs, it changes a little bit of which joints we're looking at. But the most common are our elbows, our hips, and our stifles. Stifles currently aren't a routinely screened radiographically joint, but it's important if you are doing a whole lateral view to kind of try and include them for the general baseline. But it's important to see how is that joint put together? Do we have incongruency in our elbow? Do we have laxity in our hips? Because if those do exist, we know that dog is likely to develop osteoarthritis. So we want to help support that cartilage and that joint from the get-go, whether that be with weight management or joint supplementation, diet change, activity changes, therapeutic exercise to make sure we're building appropriate muscles to help support that joint to be in the most biomechanically correct movement that we can get it to be in.
Sometimes I think about therapeutic exercise, for example, or exercises, and that can sound kind of intimidating as a general practitioner of like, I'm not a rehab specialist. I don't know what these exercises are. But the more I learn, the more simple some of these exercises are. I've heard sit to stand or shake to work the elbows and walking up and down stairs and simple things like that that we can talk to pet owners about and have them start early as just a really simple preventative strategy. They have to train their puppies anyway.
Yeah, definitely. And it's most important when we talk about posture. So just you and I, how are we standing? How are we moving? We know if we sit in a car for a really long time and our back is rounded, that when we get up out of it, we're a little sore in our lower back. So definitely from a preventative strategy for puppies from the get-go, enforcing them to sit with a nice square sit with their knees over their toes and that nice elongated spine. And same thing with a down. We don't necessarily want them kind of flopping to one side or the other, or that really cute kind of pit bull where their feet are tucked behind them. So both of those things that we are things we try to discourage. And then just like you alluded to, you don't have to be a rehab specialist to start therapeutic exercises. A lot of times I tell my clients just getting the dog to get up and down, there's some data to support dogs standing on just objects helps engage stability muscles to hold themselves in space. And everybody has something at home they can stand on. Like you alluded to, stairs is a wonderful exercise if the dog is not already uncomfortable and kind of getting them to push up. So a lot of people don't know our dogs are front wheel drive, meaning that they are front forelimb focused in how they're moving and how they're engaging with their environment. And they kind of only learn to use their hind end in explosive activities like sprinting or jumping. And so when our dogs are young, that's when they develop their muscles in their hind end and their limbs back there. And as they age, they don't use them as much because they're not as active. So kind of encouraging our dogs to learn that they are all-wheel drive instead of just front-wheel drive is as simple as getting them to walk over a broomstick or over some sticks in the woods when you're out on a hike to give them that kind of idea of where their hind and feet are in space is really important.
Gosh, that's such a light bulb moment thinking of them as front wheel drive. And I think that to me, it makes sense where sometimes we see that pain at the TL junction when they're
Yep.
kind of twisting and turning if they're really leading with that front end instead of pushing off with their back end.
Yeah, definitely. And what we will often see when we talk about posture when a dog is standing, and Dr. Chris Zink is wonderful for this in a lot of the books that she puts out there, of how are they standing? Are they standing square or are their feet kind of tucked under them? And so when their feet are starting to tuck under them, it really puts pressure on that TL junction that we're talking about. And then their hips are flexed in that area. So the iliopsoas muscle, which is kind of up in the inguinal area under the other side of the spine, that gets also kind of contracted and tight. And so when a dog does a sprint or a jump really quickly, that muscle has been contracted for longer periods of time. And therefore, it has this explosive kind of extension or eccentric contraction, which can lead to injuries longer term. So those are also important things to keep in mind for sure.
Rehab is so cool. Like there's just so many little nuances of just how the body is put together. I think it's the same reason I like endocrinology. Like if you affect this, then it changes this down the line and just so many little things that affect the whole.
Definitely. And it's really a whole body approach with everything. So when we're talking about dogs, right, when we think about end of life care, it's not just their, disease or comorbidities that they end up with later in life, but that mobility. How do we keep them mobile forever? And that's where osteoarthritis really plays a huge role in our whole canine population.
Absolutely. I feel like that's something we just need to keep shouting as a profession because it just breaks my heart when I see these older dogs who are totally with it otherwise, but man, their mobility is compromised.
Definitely.
So, thinking of our screening radiographs and our at risk breeds,
Mhm.
if we noted osteoarthritis, particularly maybe radiographically in a dog who's not necessarily symptomatic, not painful, but is an at risk breed, so we were looking for it, what would your first line of intervention be?
From a preventative strategy for a dog that's not yet showing signs of osteoarthritis, one of my first intervention is joint supplementation as well as weight loss and then therapeutic intervention with therapeutic exercises. Not the most complex, but again, kind of keeping them a little bit mobile. And depending on the owner's time or the general practitioner's comfort level and prescribing those exercises, it's really just kind of lifestyle modifications of, moving through the house with potentially not wood floors and maybe a couple more carpets or not encouraging the dog to jump off and off the 3-foot bed that type of thing.
Yes, the jumping down off the bed kills me because it's such a hard, once they do it, it's such a hard
Right.
habit to break that I'm just like, oh, if we can just not let them do that to begin with, we'll be in better shape.
Yes. Or introducing stairs to a bed, and then there's a therapeutic exercise every night.
There we go, up and down, both
Yep.
ends. Well, and I like your answer there as far as lifestyle modifications and that you bring up joint supplements because I'm thinking of my experience with my own dog who is a Labrador. So of course, early osteoarthritis signs that we've seen. And actually radiographically, the last time I checked, he looked pretty good, but he's got that one leg that's a little funny and he does some stuff. So I did end up starting joint supplements with him early. I know the data for starting joint supplements in a pet who, really doesn't have osteoarthritis is maybe a little bit lacking, but something you said that we can't change how they're put together really spoke to me where I went, well, if he's a breed that's prone to it, probably keeping that inflammation down as much as possible and supporting that joint as much as possible probably is only going to help him in the long run.
Definitely. And so for a lot of our working dogs, even if their pre-screening radiographs look good, we still know they're going to put extra wear and tear on their bodies, just like any elite athlete on the human side would. And they take supplements as well. So it's more of a holistic approach. And like you said, we don't have necessarily the literature to back it all yet because there's not enough funding for a lifetime study, right? To kind of prove, hey, before you have it and did it delay it or not? And hopefully that'll come in the future. It's something I'm really passionate about. But definitely it's something we implement because we want to talk about the whole joint, right? Osteoarthritis is a joint disease, it's a degenerative disease. So if we can help keep that cartilage and synovial fluid healthy from the get-go, when they sustain those micro traumas or as they sustain the low levels of inflammation, can we help support the body and the joint to help keep it safe and repair itself or hopefully mitigate some of that inflammation long term so the dogs are not changing or weight shifting their gait that might then predispose them to another injury somewhere else with a different joint as well.
I think that makes sense, kind of have those building blocks, those repair mechanisms at the ready.
Yeah, definitely.
So, kind of switching gears from the more preventative, asymptomatic dog, what if pain or restriction is noted on your orthopedic exam?
Definitely. And it's not just the orthopedic exam, but the mobility kind of sports med whole exam, right? Because there's lots of times that we see them in a context of our exam room and we're kind of manipulating the joints and they may or may not show us what's happening. They're a little stressed about being there, but it kind of the exam starts the second the client walks across the hall, right? They're bringing their dog into the exam room. How are they moving? Are they having a change in their gait? Are they showing a lameness? Are they avoiding, the slippery surface a little bit more? And I never did that previously in our veterinary hospital. Will they jump up onto the chair? Will they not jump up onto the chair? One of the earliest signs that I see with dogs with hip or lower back pain is they won't want to jump with their hind end anymore. They like to pull with their forelimbs to get up onto an object. So that's another big change that you'll see even getting in and out of a car. So when we are starting our exam and we're seeing those dogs that do show signs of discomfort, it's pain management through NSAIDs, through weight loss is usually a big one because most of our patients are overweight, as well as therapeutic exercise. And then I will also do joint supplementation, mainly to protect the other joints that are being stressed based on that dog's kind of change in mobility.
Sure, that makes sense because like we mentioned, talking about rehab, that everything is connected and the pathology in that one joint is certainly going to change the way the dog carries itself on the remaining joints.
Definitely. And we do have some support through the literature to say that just because a dog has radiographic evidence of osteoarthritis doesn't necessarily mean that that's the joint that's causing the discomfort as well.
Oh, you're kidding. Tell me more about that.
Yeah, so there's a recent study where it used PET CT in elbows of dogs to try and figure out bone activity. And so looking at that cartilage, looking at that bone remodeling, which is what we think of when we think of osteoarthritis. And so a dog that presented, some dogs had active inflammation in those joints and it correlated with our physical exams. And other dogs had restricted range of motion, our orthopedic exams, but they weren't actively expressing inflammation. So that joint actually wasn't actively causing discomfort. So it's kind of like we talked about earlier, treating the patient, not just the image.
We've talked about joint supplements off and on throughout our conversation here, but I'd like to circle back around and just kind of give you the opportunity to summarize your thoughts on the role of joint supplements in multimodal management of osteoarthritis. So, how do you typically use joint supplements in the management of osteoarthritis?
So it's a great question. And when we talk about joint supplements, it's kind of this wide net of all different ingredients that we've kind of been looking into in the veterinary space. So we have omega-3s, which are most scientifically validated to help treat arthritis or help deal with the inflammation. Then we have some newer products and new investigations with green lip mussel, ASU, phycocyanin, boswellia, turmeric, all of these different supplements we're looking into to help stop the inflammation that is happening with arthritis and hopefully decrease some of the pain in our canines that are affected, as well as I talked about already, promoting overall joint health of those other joints that maybe don't have osteoarthritis. So it's really a whole dog approach. I'm really excited about the literature coming and that we're looking more and more into what is effective. We're also learning a little bit about what's not yet effective. So we recently have learned in the veterinary space that glucosamine and chondroitin are not really well bioavailable. So when they are given orally, they don't actually get to where we would like them to or processed as well as we originally thought. But now we know that we can focus on some other areas of joint supplementation and kind of those extra pieces that might take us over the edge. So with all the different options and for general practitioners, it's kind of a bit overwhelming. Even sometimes for me, it's a little bit overwhelming with all the different products coming out and what's best for that patient. It's important to think about cost of the supplement. It's important to think about how that supplement's put together, palatability, all those different pieces, the safety mechanisms kind of put in place to make sure that supplement actually has what it needs to have in it. For our working dogs, we are very big on omega-3s, like I already talked about, because literature supports it the most. So for our working dogs, we're really big on omega-3 supplementation, not just for joints, but also their hair and coat health. But for long-term musculoskeletal, because we talked about the literature is not yet there to support which is the best kind of combination moving forward, we're still feeling out which is the best products and are really open and excited about some collaborations in the future investigating the supplements for our canines.
Absolutely. We're hearing more and more about the different ingredients and how they're used and how they kind of complement each other. And I'm also very excited for the data coming out in the future that's really going to help support our choices here. And I'm curious, with what we have available now, there's still so many options out there, and it's really hard to, like you mentioned, know the ins and outs of all the ingredients, all the supplements, how to combine them, how not to combine them. So I'm wondering, can you give us some general recommendations on how to choose a joint supplement and how to talk to our clients about it?
Yeah, definitely. So what's most important, like we talked about, is what are we treating or what are we trying to accomplish with our joint supplement? I think it's really important to think about what other factors we're giving this dog. So many food products now include supplementation within them. So they're including glucosamine and chondroitin. They're including omega-3, so DHA and EPA. They're including their own levels. And so it's important to make sure that we're adding a supplement that complements those or helps supplement those diets as well. So it's also important to know, does the dog have any allergies? Does the dog have any food sensitivities? The dog doesn't like, are they very palatable or not palatable? So one really exciting product out there is Decra's Ficrox. They have a hypoallergenic version for a joint supplement, which I have been really excited about because a lot of our patients do have a little bit of food sensitivities. So having a hypoallergenic option is huge. And I know our dermatologists are excited about it as well.
Absolutely. I just recently learned about hypoallergenic Ficox, and I was like so excited because we see a lot of food sensitivities, ingredient sensitivities, and it does feel limiting when we're talking about joint supplements. So then I learned that there's this hypoallergenic option, and it's so exciting.
So it's really important for our clients as well to know that we're treating their whole dog and thinking about all of their medical conditions, not just their osteoarthritis or their joint health. So taking in account those dermatological issues or food sensitivities when we're supplementing something is huge because other than mobility, maybe a scratching dog is the most uncomfortable at home for our clients.
Yes, yes. And one where we will have the most unhappy patients and unhappy clients if we don't address that. What about third-party verification? That's always something I keep in mind because there is so much to choose from that I feel like when I can look for some sort of verification, it helps me narrow down my choices of supplements. So what sort of certifications or, kind of extra seals of approval do you look for when you're choosing a supplement?
It's a great question. So there's the National Animal Supplement Council, and they're kind of an extra stamp of approval or certification that I really look for when I'm choosing my joint supplementation. And so they do ingredients clarity, they do quality assurance, they report adverse events that happen, as well as just general regulation of what's in the product and make sure quality assurance is met. So by having that extra seal of approval, it shows dedication by that company or that supplement to the product and to overall safety and health for our patients. So that definitely is something that I look for when I'm prescribing a joint supplement or giving a joint supplement to a patient.
And I'm glad that you bring that one up as kind of that extra seal of approval, because that's a certification that I'm also aware of and I look for when I'm choosing supplements. So I'm really glad to know I'm on the right track with that.
Definitely.
Well, Dr. Ramos, thank you so much for joining me. This has been such a great talk, and I really appreciate all the great information. I think you have such a good way of framing things that they really resonate and make sense.
No, thank you. It's exciting. I would love to talk about this topic and help keep our canine patients safe, and hopefully preventing arthritis, or at least making them feel better when they are having issues with osteoarthritis.
And thank you to Decra for partnering with us for this edition of Vet2Vet. Check out nabcsvetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.